Hey, Katie and Eric. Well, of course, I'm over here at Wells Plastic Surgery and Skincare with Rachel and Susan Wells. How are we today?
Good morning. Thank you for coming.
Well, it's fantastic. What we're doing right now, we're doing a spring demo day.
Absolutely.
And this is starting from 10 till 6
Yes.
over here at your clinic. All the information, as you can see, is up on the screen now. But what Rachel is doing now, we're doing a lip injection.
Yes,
Talk
we
to us a
are.
little bit about that.
We're doing Restylane Silk. Emmy was injected 5 months ago, and we actually enhanced the edge of her lip to give her more structure and made a beautiful Cupid's bow. She's obviously a really healthy young woman, so today the goals are just to add more volume. We've injected this half of her upper lip, and Rachel's now injecting the other half, so I think you can see how she has great structure, but just a little more volume on that side.
And this is the look that everyone's wanting now, a much plumper lip without it looking overdone.
Correct. And we spend a lot of time talking to people about what their endpoint is, and they even bring pictures.
And Susan, I wanted to ask you, when you say you're using Restylane, is that correct?
Restylane Silk.
Restylane Silk. How long is that lasting in the lip nowadays?
Well, it depends on your metabolism, some other things, but we really say about 4 or 5 months. It does have a residual effect, so if you will retreat in about 4 or 5 months, you may go longer, even to a year or so.
Okay, so for people at home who haven't had lip injections,
Yes.
what are the do's and don'ts before you come into the clinic to have anything done and post-injection as well?
That's a great question. One of the biggest things we ask you to do are not to take medications or supplements that make you bleed, so you're more likely to bruise. We also ask you not to wear makeup afterwards for 3 hours because we don't want to contaminate the site.
That is perfect. And I was interviewing Dr. Wells in the studio one day, and he said one of the things that he loves to encourage his patients to do is use arnica in
Yes.
before any injection
Yes.
or any surgery.
Yes.
And what's the purpose of that again?
Arnica decreases inflammation and actually helps bruising go away a little faster. If people are really concerned about swelling and looking awkward, we also offer some medications that prevent that.
That's amazing. I want to quickly touch on the demo day today that
Okay.
we're doing over here at the clinic. What is it that people can expect?
Well, every hour we're going to showcase various services in our non-surgical care. We'll have tattooing, we'll have hydrofacials. I'll be doing some Botox and Dysport. She'll be injecting some cheeks and lower face. And it's just a full array of things, including Dr. Wells being here.
And that's one of the best things. You can come over here free of charge today, everyone. Not only do you get discounts on any products or services that you're offering here, but you get to speak to Dr. Wells and talk about any concerns that you might have or any procedures that you would like to have done in the future. Susan Wells is amazing. Rachel Bradford, the team over here at Wells Plastic Surgery and Skincare really do know their stuff. And they've been part of Midday Kentucky, and we've got to know them as part of our family and the things that they do over here at this clinic. If someone's feeling a little bit insecure
Yes.
and not thinking, I'm too nervous to go in first, what do you say to them right now who just want to jump in the car and say, I want to go and see Susan?
Well, she needs to come over here, or he, actually, and we'll have a quiet little private consultation.
Yeah.
And we'll talk about what their
Because
goals are.
it does intimidate some people because
does.
they think about it. They see everyone like us talking about these procedures, but they do feel insecure and they don't want to be in a room full of people. So what you're saying, Susan, is that you can take people into a little room,
Yes.
have a quiet conversation, and put them at rest.
Yes, in fact, Dr. Wells is doing many consultations that are very private in his consultation room.
We love that. Very quickly, I want to ask your opinion. What do you believe is the right age to start doing lip injections?
I think it's the right age if you're over 18
Yeah.
and you desire that.
All right. Thank you so much, Susan. We're going to have so much more coming up. Katie and Eric, back to you in the studio.